In this video, we're gonna learn about different needles and what we use them for. So I'll start with this needle over here. This is a plastic needle, and we basically use it to access valves. So plastic needle for accessing valves. I'll just open it up so you can have a look. So here we go. It's just a sharp plastic needle. It won't prick your skin, that's why we use it. So I'll just put it in there. Then next we have a blunt needle. So I'll just show you what it looks like. It's a blunt needle. Again, I'll be mischievous in testing it out. It's blunt, so it won't prick me. And we basically use the blunt needle to prevent needle stick injuries, but when we are accessing ampules. So this is an example of an ampule. Once we break the ampule, we can use the blunt needle to be able to do that. So I'll put it away. Then here we have got a 20 gauge needle and a 19 gauge needle. Now the trick about needles is that the smaller the size of the needles, the smaller the size of the needles, the bigger the number that they are allocated. Or if I say it in other words, the bigger the needle, the smaller its number. So its gauge, so here 19 gauge, 20 gauge is a big needle, 25 gauge is a very small needle. So what we use them for? So 19 gauge and 19 gauge and 20 gauge needles, we use them basically for the same things, accessing ampules and accessing the valves if we don't have the plastic cannulas that I showed you before. So I'll show you how big they are. So I just open them up. So this one here, I can't go again like this because it will actually cut my grab, very sharp. So this one here is a 20 gauge needle. This one is another big needle, 19 gauge needle. So basically use them for the same thing. So now we have a green needle, 21 gauge. We mainly use this needle here for venipuncture. Mainly use it for venipuncture. We could use it also for ampules and valves, but basically we mainly use it in hospitals for venipuncture. So I'll just open it up as well and just show you what it's a very sharp needle. So I'll just put it away. Then we have this blue needle, 23 gauge. Again, then bigger the number, the smaller the needle. So with a 23 gauge needle, so much small, much finer, we use it for intramuscular injections. Intramuscular injections, blue needle, 23 gauge. Then here we've got a 25 gauge needle. So the 25 gauge needle, we use it for subcutaneous injections. So here we go. So here, subcutaneous injections, and that's the orange needle, 25 gauge. I'll put it away. Then for insulin injections, we have to use an insulin syringe. As you learn through the course, you could actually ask your educator in your prac room why we use specific insulin syringes. That will take a long time to explain, but this video is just for the learning needle sizes. So the needle size here, you might actually not be that visible on camera because it's 28 gauge, very small, fine needle, subcutaneous injections, but this syringe is basically for insulin injections. Insulin injections need specific needle which is already attached to the syringe, and the syringe which measures in units. But I'll put it away as well. Thank you very much.